A bone is a strong connective tissue that contains specialized cell in a matrix that is made out of calcium phosphate and calcium carbonate. When the end of two bones meet, a joint is made. This can also be known as an articulation. One of the specific joint types is a synovial joint, or a diarthrossus, which is a joint where the ends of the bones are separated by synovial fluid. This feature allows for a wide range of motion. Periosteum is a membrane that wraps around the superficial layer of compact bone. In a synovial joint, the periosteum is continuous with the joint capsule. In a synovial joint, a joint cavity is formed when the bones of a joint are surrounded by a synovial membrane and articular cartilage. A synovial joint is comprised of articular cartilage, a joint capsule, a synovial membrane, and a joint cavity containing synovial fluid. Articular cartilage covers the outside of the bones in the joint. This cartilage allows for the bones of the joint to never come in direct contact with one another. The joint capsule is made of a synovial membrane and an outer fibrous capsule. The membrane does not cover areas of the bone covered with articular cartilage. The synovial membrane is the layer of the joint capsule that lines the inside of the joint cavity. It is comprised of a layer of incomplete fibroblast, or connective tissue. The synovial fluid is contained in the joint cavity. The synovial membrane creates the synovial fluid. This fluid is used for lubrication to greatly reduce friction, distribute nutrients, dispose waste, and absorb shock. There are 6 different types of synovial joints. A hinge joint is where the two bones meet and can only move in one direction, a backwards and forwards motion. An example of this is the knee joint. A gliding joint is when the bones meet at a flat anterior surface, which allows the bones to glide past each other in any direction. However, the movement produced by this motion is very small. This can be found at the clavicular sternal joint. A pivot joint is where the bones meet and only a rotational movement can be performed. An example of this is the movement produced at the atlas and axle joint. A condylar joint is formed when one bone has an oval face and is nestled within a depression of another bone. This allows for a forward and backwards movement of the distal end. This is the type of joint formed at the radiocarpal joint. A saddle joint is when one of the bones is concave while the other is convex, which fit together. An example of this is the first carpometacarpal joint. A ball and socket joint involves a bone with a round-shaped head and a cup-shaped indentation of the other. This allows for a multidirectional rotation. This is found at the shoulder and hip joints. Each joint has a range of motion. This is the amount of movement possible from full extension to full flexion. A muscle attaches to a bone in 2 different places. Where a muscle attaches to a bone that doesn't change when a muscle contracts, or a fixed point, is the origin. The insertion is the point where a muscle attaches to a bone at a mobile point. A lever is a structure that moves on a fixed point. Movement is created when enough pressure is applied to overcome the load. Each bone in the body acts as a lever. Levers can change 3 things: the direction of the applied force, the distance and speed produced, and the effectiveness of the strength. A fulcrum is the fixed point in which a lever rotates around. In the body, every joint is a fulcrum. The resistance of the object is the load. In the body, the load can vary from the whole body weight to the weight of the object in a hand. Applied force is the force required to move the lever. There are 3 different types of levers found in the body. A first-class lever is when the fulcrum is positioned between the applied force and the load. An example of this is the extension of the neck. The load is the weight of the skull, the fulcrum is the base of the skull, and the applied forces are the muscles attached to the base of the skull that contract to move the head down. A second-class lever is when the load is positioned between the applied force and the fulcrum. An example of this is when the ankle extends by the use of the calf muscle. The fulcrum is the ball of the foot which stays fixed on the ground. The load is the weight of the leg, and the applied force is the calf muscle which pulls up the leg and foot. A third-class lever is when the applied force is positioned between the load and the fulcrum. This is the most common form of lever found in the body. An example of this is the flexion of the arm. The fulcrum is the joint of the elbow, which stays in one position throughout the movement. The load is the weight of the lower arm and anything held in the hand. The applied force is the bicep muscle, which pulls up the arm when flexed.